Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Somi Javed. She's an obstetrician gynecologist, and she's the founder and CEO of Her MD. She wrote the Kevin MD article, How I Lost Sight of My Own Healthcare While Creating a Women's Healthcare Company. Somi, welcome to the show.
Hi, thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Absolutely. I'm an OBGYN, like you mentioned. I went into women's healthcare because I nearly lost my mother at the age of 45 to cardiovascular disease. And I decided there and then that I was not going to be a barrier to women's healthcare, and went to medical school and went on to residency, and then had a very traditional job, but found I couldn't be an advocate because I was seeing patients every 15 minutes. Decided right before my 40th birthday to buy a building and open a practice that was very patient-centric, called it Her MD, and just opened our second location and planning our third already. So that's my story. We specialize in menopause and sexual health care. We specialize in longer appointment times and making patients feel very, very comfortable in our space.
So tell me that transition from a traditional OBGYN job to something that you own. Almost sounds like a personalized private practice clinic, and certainly a lot of business aspects that go into that. So tell me about that transition into what you're doing now at Her MD.
Yeah, it was absolutely crazy. It was awe-inspiring. I used parts of my brain I did not know that I had, and had to develop skill sets that we traditionally don't have as physicians. So I took a lot of courses. I surrounded myself, reached out to my network of people who were not only physicians who own their own practices, but business owners, accountants, and learned everything that I could in a very short amount of time. And then we're used to physicians on the job training as well. I was lucky that I had a very large patient following anyway who did follow me as I opened my own practice. But took a lot of courses and learned on the job, and have grown the practice to nearly 8,500 patients in 6 years. And I know a lot of physicians who want to open their own practice, and I encourage them to do so. But you're right. And then as I grew, I could no longer handle all portions of the practice. So I have hired people and brought them on to handle different portions of the practice because I'm still very involved in patient care.
So as you said before, a lot of physicians, we don't have the business training in medical school and undergraduate studies. So tell me, what were the biggest challenges that you face in making that transition to opening your own practice?
Yeah, so I don't have an MBA, but had a natural business sense, I think. And so there were a lot of things I didn't know, even, how to structure the practice and how to structure the corporation and accounting and getting accredited with medical billing, because we are an insurance-based practice. I had always had, I'd been a hospital employee, a private practice employee. That was always done for me by the credentialing department. So learning how to do that, learning how to set myself up in an appropriate tax way, learning how to finance equipment and open certain business accounts. So it was a continual learning process. But what I was so surprised about, physicians, we all are so used to working together as a team because we care about patient outcomes. So business owners were so welcoming and so warm and so willing to help. And so that was my learning experience, was that. And I'm still continually learning, 6 years into owning my own practice.
Now that you've had experience in both worlds, both as an employee and owning your own practice, if you were to start all over again, which would you jump into first?
100% owning my own practice. I have realized that I am meant to be a business owner and meant to be an individual. I really enjoy the autonomy. I enjoy being able to preserve that patient-physician relationship. And I do not appreciate being told what to do to make a hospital system or a private practice more money. I don't want anything interfering with my relationship with patients, because that's why I truly went into medicine. And most of us do, for the love of the art of medicine. So for me, I think that physicians, we're smart people. I think we can learn the skills. Some of us may choose to get an MBA, but private practice, definitely, especially the way insurance systems are pushing us with lower reimbursements and having to see more and more patients. And with EHR and having to see a patient, make an assessment, do the physical exam, document and place orders in a 15 to 20 minute window, I think has put crushing expectations on a lot of physicians. And when we graduate and we're so idealistic and we want to make such a difference, I think private practice is the way to go, as long as you go in with open eyes and you've educated yourself about what it entails.
All right, so let's transition now into the Kevin MD article that you wrote. It's titled, How I Lost Sight of My Own Healthcare While Creating a Women's Healthcare Company. Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
Yes, I wrote this article on a particularly frustrating day. Everyone has their own stories from the pandemic. And as a physician and a mother and a business owner, I found myself in the midst of what I would call a storm. And I was just trying to put out fires and dealing with COVID and trying to keep my patients safe with new regulations, trying to keep the business afloat, trying to keep my 18 employees safe at the time, right? This is before we had vaccines. And then all of a sudden I had 3 children who were at school full time, which really allowed me to open my own practice, but they were home and they were fearful as well. And I'm married to a physician who is an oncologist, so he was actually in the COVID unit. So I'm trying to put out all these fires. And I am, as I wrote in the article, I'm very healthy. I'm a yogi. I love to be outside. I love to have that balance. And all of that went by the wayside. And I found myself eating in ways I traditionally don't eat, not thinking about what I was doing, exercise not in months. I wasn't sleeping. I had severe abdominal pain. I actually developed a hiatal hernia, gained a lot of weight in a short amount of time, and just was not making wise choices. So here I was with this really large practice and advocating for women to take care of themselves, and completely lost myself in that year.
So you talk about the competing priorities that you had, both with your job, running a business, and at home. What are some of the things that you did to help manage everything, or what are some of the lessons that you've learned after going through that?
So I definitely brought on some more help during COVID, despite the fact that we did suffer some business losses. I was able to get some help to secure some loans because as I was seeing patients, I didn't have time to fill out all those applications. So definitely bringing people on to help me through it. I brought on help at home with the children, even though they were older, they needed help with homework. They needed help, staying focused on their Zoom classes. And so asked for help. Definitely, that was the number one lesson that I learned. And number two, as physicians, as mothers, if we don't take care of ourselves, we cannot take care of others. And I definitely prioritized my children and my patients first. I don't regret that. I just wish I would have also prioritized myself. But I'm recovering. I did get a health coach. I was able to do that. I realize not everyone can do that. But my sister, who was one of the people I reached out to and said, I'm overwhelmed, Mayday. And she introduced me to this executive coach who really helped me start to get my life back on track.
What are some of the techniques that executive coach did to kind of help manage and prioritize things?
The first thing that she did to me was told me, take your Google Calendar, and just like you have patient appointments, just like you schedule everything for your children, start scheduling time for what is important to you, whether it's getting back and hiking outside, whether it's yoga, whether it's, cooking a meal with your husband. Do not be embarrassed to take your own time back for your own mental health. And so that was the first thing that she did. The second thing was encourage exercise. And the third thing that she did was really help me prioritize allowing other people to help me and take over projects that I was working on at the company and take them over permanently, not just because of the pandemic, but really being able to trust my team and let them take ownership over tasks that I didn't need to be managing anymore.
We're talking to Somi Javed. She is an obstetrician gynecologist and founder and CEO of Her MD. He wrote the Kevin MD article, How I Lost Sight of My Own Healthcare While Creating a Women's Healthcare Company. Now, one of the things that I'm hearing is that you have had a lot of mentors, guides, and resources to help you along the way in managing everything. So for those physicians who also have a private practice and a very busy family life, just what are some of the resources that you could share online in terms of where physicians can look for help?
Yeah, so definitely. In Cincinnati, for example, there's a group of physicians that have come together. It's an independent practice group. And so obviously during the pandemic, we couldn't get together, but once a month we try to get together at a restaurant or over Zoom. We share just stresses and joys and discounts on buying equipment together. So definitely look in your local communities. You can get online and create chat groups and reach out to each other. There's also on Facebook, I'm sure you've heard of it, it was just on the Today Show, a physician mom group. It's 76,000 women strong. We get on there and everything from child care problems to tough cases at work. So I definitely say, especially in this day and age where people are still not maybe getting outside, use those Facebook groups or those social groups or your local groups to stay in touch with physicians and people that you know who are in the same boat as you. I learned that I'm not alone. I learned to reach out and ask for help. And I think as physicians, we're not used to that because we're usually the healers. We're usually the ones offering help. And so this was a very, very humbling process for someone like me who's not used to asking for help.
The numbers of private practices over the years are slowly dwindling. And you really talk about some of the pros that private practice brings you. Now, not every physician, of course, is cut out for private practice. So what are the characteristics of physicians that will make them more suitable for private practice life?
I'd say the number one thing is you have to be passionate. You have to love what you're doing. Number two, you cannot be risk averse. There may be months where you have an unexpected bill, something breaks. The insurance payments don't come in 30 days, they take 45. So you have to be able to tolerate not paying yourself on a regular basis every 2 weeks or every month. You have to be confident. You have to be willing to let other people help you and build a very strong network around yourself. So those are definitely, that's what I look for when I bring people even into my private practice, that they're willing to do that and don't need to be in a structured setting. And independent thinkers, physicians who are willing to think outside the box, for sure.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Twofold. If you want to open your own practice, do it. You will succeed. Physicians will find a way. And never, ever forget to take care of yourself.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you.